What happens during pancreatic cyst surveillance? Imagine discovering a small bubble in your pancreas during a routine scan. What comes next is a careful process designed to keep an eye on that cyst and catch any changes early. Pancreatic cyst surveillance is all about monitoring these cysts over time to see if they stay stable or if they show signs of becoming more serious. The goal is to protect your pancreas health and catch potential problems before they develop into something more dangerous. When a cyst is first found, your healthcare team will do an initial assessment. They look at the size, shape, and features of the cyst and consider your age, symptoms, and medical history. This helps determine whether the cyst might be risky or likely to stay benign. They also check for signs of high-grade dysplasia, which means precancerous changes or even early cancer. The main tools used in surveillance are imaging tests. Magnetic resonance imaging, or MRI, combined with magnetic resonance cholangiopancreatography, called MRCP, is the preferred method. It provides detailed pictures of the cyst and the pancreatic ducts without exposing you to radiation. If the images aren't clear or if there are concerning features, your doctor might recommend an endoscopic ultrasound, or EUS. EUS uses a tiny camera on a flexible tube to get close to the pancreas and offers high-resolution images. It also allows for a procedure called fine needle aspiration, where a small needle is used to collect fluid from the cyst for testing. Sometimes, a computed tomography scan, or CORT, is used to evaluate the cyst. However, because CORT involves radiation, it's usually reserved for specific situations rather than routine surveillance. The frequency of follow-up scans depends on what the cyst looks like. For low-risk cysts that don't show any worrying features, imaging might be scheduled every 6 months to 2 years. If the cyst grows, develops nodules, or if the main pancreatic duct becomes dilated, your doctor might suggest more frequent scans, sometimes every 6 months or sooner. In some cases, analyzing the cyst fluid can provide valuable information. During an EUS procedure, a small amount of fluid is drawn out with a needle. This fluid is tested for tumor markers like carcinoembryonic antigen, which helps differentiate mucinous cysts that could be precancerous from non-mucinous cysts. Cytology can also be performed to look for abnormal or cancerous cells, and molecular tests can detect genetic mutations associated with higher cancer risk. Decisions about what to do next are based on what the surveillance shows. If the cyst remains stable and no high-risk features are detected, your healthcare team will likely recommend continued monitoring. But if concerning changes occur, such as rapid growth or new nodules, surgery might be considered to remove the cyst and prevent cancer development. The key is balancing the early detection of potential problems with avoiding unnecessary procedures. Throughout this process, clear communication is essential. Your healthcare providers will discuss the risks and benefits of surveillance versus surgery, and your personal health and preferences will be taken into account. Every patient is different, and surveillance plans are tailored to fit individual needs. In summary, pancreatic cyst surveillance involves regular imaging, sometimes fluid analysis, and ongoing clinical assessments. It is a careful, step-by-step approach designed to catch any changes early and keep your pancreas healthy. If you have a pancreatic cyst, working closely with your medical team will help ensure you get the right monitoring plan for your specific situation. Always remember to seek personalized advice from your healthcare provider to make the best decisions for your health.